Hello everyone, welcome back to another episode of USTM Podcast. I'm your host Beepanshi Kaushik and today we have a special episode lined up for you all. In today's society, lifestyle related diseases is one of the greatest problems of today's society. Many people are suffering from these lifestyle related diseases like hypertension, obesity, etc. and cancer being one of such diseases that has been heavily discussed about, and people need to be more aware about the early detection and prevention of cancer. And to discuss on this issue, we have Dr. Nency Brahma, Assistant Professor, ENT, PIMCH. And we have Dr. Nancy Ma'am among us to discuss about oral cancer, its early detection and prevention. Ma'am, it's a pleasure to have you among us.
Thank you, Beepanshi. Thank you for calling me and having me here for today's show.
Dr. Nancy, how do you describe cancer to the general masses watching this show?
Yeah, so all of us must have heard of, and the society also, they are just like diabetes, cancer, which is emerging, and then people are also getting affected day by day, in and day out. The incidence is increasing even in Northeast India. So let's start with, what is cancer? Like Gautam Buddha said, anything in excess is poison. So whenever a cell outgrows in excess, you see our body has a self-cleansing, self-healing mechanism. Whenever a cell outgrows, doesn't follow the command, and they outgrow in number, in size, as you can see in the slide, and then how a normal cell behaves and looks like, and then when it multiplies in excess, it can grow in thousands and thousands in a day also. So whenever any tissue outgrows in number or size, they ultimately it leads into a tumor. That is what cancer is all about.
Thank you, ma'am. As today we are mainly discussing about oral cancer, could you please define or describe oral cavity?
So to begin with, we need to know about oral cavity. So for the general public, to take care of your oral hygiene, to maintain oral hygiene is of utmost important. How to brush their teeth regularly, twice a day, because apart from normal commensals, there might be some bacteria because the food every day we consume, and so it's very important to take care of one's oral hygiene, to maintain one oral hygiene. So we can see in the slide there are different parts. So apart from knowing what parts, for the general people it's very important, if there is any tooth caries, if there is any ulcer in the mouth, so these are very important thing not to be ignored. So tonsils and uvula are not tonsils, and the posterior part is again it falls under different part for us. But so for the people per se, to know about this oral hygiene, and to maintain, not to ignore the dental pain or the dental tooth caries or any swollen gum, and to keep their mouth and teeth clean, those are very important things to be noted.
Ma'am, as you're talking about the current scenario or the current statistics of oral cancer, what is the current global, national or regional scenario of oral cancer?
Yeah, so head and neck cancer per se is the 7th most common cancer. So globally, around 4 lakh new cases are detected. So in India also, it's an emerging disease, although lung cancer is the most common among men and breast cancer among female. So in Northeast India, you will be surprised to know that in man, it's affecting, the incidence is highest among all cancers in all over India. So the survival, now when we come to survival rate, it depends according to the staging. So why we are stressing upon early detection, because the survival will always increase, that is will be more than 60% if it's detected early. 5 year, when we are talking about survival, 5 year survival. So and if it's if it's like no average this survival, so if it's early diagnosis it will be more than 90%. So people should not be afraid of, hesitate, and should not surround themselves in the myths that cancer is incurable. So the thing is that the main idea is that to educate the people, to make them aware, so that they can come early. So what are the warning signs? No, any like ulcer which is not healing inside the mouth, any dental loosening of teeth, any dental ulcer, any swollen gums, or like no any oral bleeding, or any swelling in the neck which is not responding to treatment or more than a month. So all these are alarming signs. So I will show you or talk about some of the like pre-malignant lesions when one should be like which are the alarming or the warning signs one should be warned of. These are the things. And this tobacco use has a very great, I mean very impactful role in causing this, more than 90% as a causative agent. Okay, so it's coming up in India because of excessive use of pan, gutka, masala, tobacco in the form of this one mouth freshener. So all those are very causative agent, are causative agent for high incidence in this part of India.
Ma'am, as you have mentioned about the recently increasing cases of oral cancer in India, what are some of the causative agents leading to this increase in the detection of oral cancer in the recent times?
That is what, like the increasing incidence, there are lots of, if we talk about a disease, it's always multifactorial, you see. So apart from the genetic, familial, we have some modifying, I mean the habitual things like excessive tobacco consumptions, betel nut and betel leaf, which is very much rampant use in this part of India. There lots of chemicals have been established which are directly related to causing this kind of cancer. So again, high excessive alcohol consumptions. So these are some of the things which is directly associated with. But the familial or the genetic things, these you cannot modify. This is something will run, or this you cannot help. But then some of the apart from this, of course, obesity and sedentary lifestyles have been associated with causing many diseases in this. But then yes, tobacco, betel nut, and alcohol, these combinations are dreadful, and one should be aware of and to be warned of, like no, these are and one more important thing is you must have heard of human papilloma virus. Of course not all the strains, but some of the strains like which are more virulent, like HPV 16, 18, they are also causative agent of causing oral cancers. Of course, they are more associated with oropharyngeal, which when we talk about the most posterior part of oral cavity.
Thank you, ma'am. As you have mentioned about the causative agents for cancer, at the same time, I want to ask you, what are the possible treatment options for oral cancer, and how does it vary according to the stage?
Yeah. So regarding treatment, see, it always varies when the person or the comes with the problem at what stage. Like if it's an early stage, as I said earlier also, so early stage, the more the recovery chances and more the survival rate, like 5 year down the lane, how much a person is going to survive, like no more than 80%. Whenever it's late, I mean it's all. And the saddest part is that in India, mostly not only in India, northeast part also, because of stigma or something around, because of financial everything, people come late stage because of the fear, might be because financial won't be correct right now, because government has taken lots of initiatives, lots of cancer hospital accessibility, keeping in mind many, so that the village people or the rural area or the farm area can be also be covered. So if it's late stage, because of the fear might be, and the acceptance, no, society, there's some stigma there, like no, cancer is incurable, or and people like to take the most simplest, I mean non-painful kind of things. So they try to take delay the kind of coming to the physician. So whenever it's late stage, of course the surgery or anything, it's mutilating, and then it's a multidisciplinary, not only surgery, but people one has to, according to the stage, might have to go for chemo radiation also, before, after, to downstage the tumor. And again, the saddest part is that if it's coming to the skin, it will go to different parts of body. The chances are very high. Nowadays we have PET CT scan to detect the whole body. Scan is done to know about the metastasis, I mean the spread of disease. So the stigma mainly, people has to be made aware that no, the more the delay, the more the complicated the treatment, and the lesser the chances of survival. This is the main thing. So any doubt, like alarming signs, any neck swelling which is not subsiding, of course tuberculosis is very rampant in our country, but then anything which has been excluded, if tuberculosis has been excluded, any neck swelling, any dental problem, any gum swelling, any loosening of teeth, any dental ulcer, any gum ulcer, so any bleeding from oral cavity, these should not be ignored. At least once they should visit a physician, or they should ask any primary health center whether this has to be looked further into. Okay.
So, ma'am, keeping the current situation in mind, what are some of the initiatives taken by the government for early detection or prevention of oral cancer?
Yeah. So every year we celebrate World Cancer Day on 4th of February and World Head and Neck Cancer on 27th July. So this year the theme was to close the cancer gap. That means there should not be fear from the public side, and they have to know when and where to go, and the care given by the healthcare providers, like where they have to go, whom they have to seek, and what are the things they have to do, what is the financial things, I mean what are the government initiatives, like government has taken lots of schemes to help them out to cover the treatment part, the cost of treatment part. So again we have World Tobacco Day on 31st of May. This year the theme was protecting children from tobacco interference, industry interference. This was a call the theme was a call for the government to protect the young people from the tobacco industry's malpractices. So so that we can prevent the younger future generations from the ill effects of this use. So there are lots of initiatives coming up so that this gap can be closed, so that people can come down, and then they don't have to need to travel far. The main problem is that not only the cost, one has to be constant, because duration of treatment is so long, so one has to be constantly, one attendant has to be there. So people once like nearby their district or in the district itself, so many Assam Care Foundation is there, so Tata Trust has built up. So those facilities are here, so that in every district they made it a point that every district can have access, so that they can be treated in the hometown itself. So apart from the treatment facilities, like we have to also keep a check on the young generations to not to be get addicted. So those initiatives are also being taken, but then mass awareness, that the one younger generation has to keep in mind that the productive age group, if they get affected, not only he or she is killing himself, but in the age of 30 to 40 years, then the whole family is dependent on him. I mean, if he's the sole bread earner, he or she. So that also has to be kept in mind. So these are poisons, whatever they're consuming, apart from our environment pollution and the pollution food. I mean, everything is adulterated. So we have to be careful, and then the younger generation has to be like very much aware of this ill effects of these habitual things.
Ma'am, so how does the screening of the oral cavity help in early detection of oral cancer? Talking about in young adults.
Yeah, this is a very important thing. Screening is very, very important, and this can be started from the grassroots levels. When we talk about grassroots levels, it includes the healthcare providers of all, even the multipurpose worker, the social worker, NGOs. Everyone has to come together. Even the Anganwadi workers can be trained, because oral cavity is very accessible. You see, if one is educated, they can himself or herself see, look at the mirror and can identify, if there is any whitish patch, if there is any ulcer not healing, taking more than a month, if there is any loosening of teeth, if there is any gum swelling, gum bleeding, or if there is any dental ulcer which is not healing. So that can be taken care of, and taken care of, so that one can be made aware. Even they can do, all these health workers, they can go door to door, they can ask about the symptom and the signs. Even they can put a torch and can see, like if there is any suspicious lesions, or if there is any neck swelling which is not healing. Usually what happens in later stage, in stage 3, 4, sometimes the patient presents with small ulcer, but then the neck, they have a big, it has already metastasized to the neck. So even so the healthcare workers at all the levels should come into force, along with the basic idea is to educate the people also. Not only they going and searching for the cases, even the masses or the younger generation, because they are addict, as you said, in young adults, because they have, if they are habitual, then they will definitely have, if they are constantly putting the tobacco in one place, they will have tobacco pouch. There will be keratosis kind of changes, and those are we have often seen using pan masala gutka, they used to have difficulty in opening mouth, they will complain of burning sensation. So all those are very pathetic for a 20 years old, less than 20 years old. So because age group, before we can see male were affected more because they were used to consume, but nowadays it's shifting. Elderly age group were more involved, but nowadays it's shifting, it's coming down to younger age group.
Ma'am, what are the precautions one should take for preventing oral cancer?
Yeah, that is what. If a cancer is running in the family, if there is a very strong family history, father, grandfather, or the uncles are suffering, one should be have a at least yearly checkup. If he is not a habitual use of all these addicts, okay. And then if one is a habitual user, one should at least be careful if there is whitish patch, or if there is tobacco pouch keratosis, which I have said. So all those kinds of things which are not healing, reddish kind of things, eruptions inside the mouth, tongue, or anything like that, or the alarming on the signs, whatever I am telling, then one should go and visit a clinician. That is what. If it's running up in the family, they should be at least doing a yearly checkup. That is what. So some of the lesions I would like to highlight, like which are very alarming, and one should be very careful about if there is any. Can we have the next slide, please, so that public can know that these are very. These can turn into, when we say pre-malignant, that means it's not cancer, but then it can turn into cancer. Whoever is having pan, gutka, masala, above right side, you can see they have difficulty in opening the mouth properly. They will have burning sensation. They will tell they cannot eat hot food or anything, like sip hot water also. So in the third slide, third picture, you can see if the person constantly puts tobacco khaini in one place, they will have those kind of lesions. There will be, ultimately it will, in the long run, it will change into dysplasia, metaplasia, and then ultimately it will be carcinoma. So one has to be careful. And then believe me, if there is a reduction, total stoppage of using all these products, it has been seen in most of the cases that it's reversible thing. So one should be made aware कि if you stop using tobacco, alcohol, anything, all the smoking. So smoking is an add-on effect, alcohol is an add-on effect on these kinds of cancers. So along with the chewing habit, if they stop all this, any kind of whitish patch and this reddish patch, they will go off slowly in the long run. So all these are reversible. Only one thing I will tell that, like in papilloma virus, we talk about HPV, vaccines are available. So it should be taken in a certain age, although not so much prevalent in our part. In oral cancer, oropharyngeal cancers we have seen, it's highly association is more than oral cancer. But in Western counterparts, HPV is a very commonly associated. It's mostly seen in white people, non-smokers. So in the age group of 40 to 60, say. So these are the things which you have to keep in mind. So I hope people we are successful in just giving and just insight into what it looks like and what is the scenario and can be taken care of. Thank you.
Thank you, ma'am, for providing such an insight on oral cancer, its early detection and prevention. It was really amazing to know about everything in detail. And I think one takeaway message from this is that I did not know about this before, that we ourselves can be more aware and cautious about our own body, especially about the oral cavity. If we are more aware and cautious about what's going on in our body, to some extent we can be responsible for the early detection of oral cancer or such health problems. Thank you, ma'am. I hope it was a really enriching experience for the listeners and the viewers watching this podcast. So with this, we have reached the end of today's podcast. Thank you, and keep tuned for the upcoming episodes of USTM Podcast.